Hi there, I'm Dr. Dan Davis. I am the Chief Executive Officer of iCare Tech, a telemedicine company located in Hawaii. I'd like to talk to you today about why I think the future of telemedicine is now. The reason it's taken us so long to get to this point is because there are a number of barriers that have affected the widespread dissemination of telemedicine. These barriers are financial barriers, they're social barriers, they're technology barriers. Among the financial barriers are the fact that, at least in the United States, our healthcare system is financed in silos so that it's difficult for an entity to which the value accrues from telemedicine to actually pay for it. An example is that we know that proper use of telemedicine to care for medically fragile patients in a technology-enabled care model can clearly reduce hospital days and emergency visits for medically fragile patients. However, it's been difficult for the insurance companies that pay for our health care to pay for those types of services. From a social standpoint, the population in general, at least until recently, has had the notion, and they've been trained to go to the doctor's office, to go to the medical center for their health care. There's this concept that healthcare is really an episodic undertaking. But in fact, good healthcare, particularly for medically fragile people and for individuals who want to stay healthy, is really a continuous process. It's not episodic, it's something that happens on a day-to-day basis. And just recently, the population has begun to understand that there are personal responsibilities that have to be completed on a day-to-day basis in order for people to remain healthy, and particularly for those medically fragile people for whom we have, with whom we have a lot of experience. It's extremely important to stay in touch with those folks almost on a continuous basis, looking at things that happen on a daily basis, and through that kind of continuous care as opposed to episodic care, we can do a better job. So changing that social health paradigm has been something that's really important. Fortunately, the barriers are falling. There are changes in healthcare financing that I think will cause telemedicine to really take off in the next 2 or 3 years. One of those is the Affordable Care Act, the organization of what are called accountable care organizations, in which those financial silos are being broken down. We have experience with over 2,000 video house calls, particularly these patients that we call medically fragile. We've learned through this experience that there are certain technologies that work, certain technologies that don't, and we've learned an awful lot about how caregivers interact with the technologies in the trenches. What we've learned, among other lessons, is that caregivers can't fiddle with launching programs, fiddling with keyboards, using mice, using conventional laptop computers and conventional software. We've also learned that the video camera for the video house call, particularly for these medically fragile patients, needs to be designed in such a way so that it's extremely easy to use, very high quality, and doesn't really interfere with the care process. Our goal at iCare Tech is to create telemedicine technologies that enable caregivers to care more effectively. That is simple telemedicine for caregivers.